Hello, this is Ahmed, medical instrumental engineer. Today we're going to go for a fast illustration for micropipettes in our laboratories that it is used. So here we're going to go. Let's start. For the micropipettes, it's the plunger, tip ejector, volume adjustment, volume indicator, ejector arm, plastic shaft, where disposable tips attach. So for today, we're going to talk a small sample for illustration inside the laboratories. However, as we know that the micropipettes is used to small and to transfer small quantities and to scale for some volumes that contains a liquid inside the laboratories. So here we're gonna go. Let's start with this illustration video. So the micropipettes generally, as we know, is inside the laboratories to transfer the small quantities of liquid, and it used to most commonly used in chemistry, biology, and pharmaceutical and drug discovery labs. So the micropipettes, it's also measure the volumes in milliliters. There are different types of micropipettes for measuring different range of volumes. Each pipette is marked as indicate with range of volumes. Pipettes is used to measure. So this is the P20, P1000 used to measure volumes from 100 microliter to 1000 microliter. This is P20 is used to measure volumes from 2 microliter to 20 microliters. This window on the pipette shows the volume of fluid that the pipette is set up to take up. P1000, the upper digit in red represents the thousandths place, that the next digit down represents the hundredth place. The digit on the bottom represent the 10th place. This micropipette is set up to take up 950 microliter. For P20, the top digit represent the 10th place. The next digit down represent the 1st place on the digit for the bottom, and the red represent tenths. This micropipette is set up to take 12.5 microliter. We will use the P20 micropipette to demonstrate how to use the micropipette. However, the principle learned with respect. This micropipette generally apply other types as well as the different of micropipettes. However, we have setting out the volume. They will take up to set up the volume on P20 gently. Pull up and turn the black wheel as well and shown in the videos. Microliters in 20. Adjusting the pipette volume, push up the black wheel back. Do not ever adjust the pipette volume outside the range. The measure will be damage this micropipette. In order to take up the indicate volume of the fluid using the micropipette, we must first place a disposable plastic pipette tip into the end of the pipettes. Different types of tips of pipettes are different micropipettes. This clear tip is used to, with this P2020, take up the fluid up into the pipettes. And the tip of the micropipettes as shown here inside the video. Make sure the pipettes is the fluid is taken up into and explain it. From pipette tip by using the Micropipettes plunger. The pipette plunger is operated by pushing down the button on the top of the plunger. The plunger has 2 stops and separate fluid up into the pipette tip. Push button down to the first stop. Continue to hold down the button. You place the pipette tip into the fluid that you want to draw up. The pipette tip needs to place it into the fluid. To draw up the fluid into the pipette, slowly release the button. Make sure that you keep the pipette tip in the fluid until the plunger has completely raised up its original position. Draw up the tip of the fluid in the micro configuration tube pipettes was for 20 microliter, so the volume fluid take up into the pipette tip is 20 microliter. To expel the fluid from the pipette tip, place the pipette into the tube which you want to expel the fluid. Then slowly push the plunger. As you push down on the plunger, the fluid to the tip will be pushed out into the tube. Remember that the plunger has 2 stops, and we will push the first stop when we were taking fluid up into the pipette. Tip up the pipette tip, push back, and the first stop is the second stop. This will expel the fluid, and that is the illustration for the micropipettes in the laboratories. Thanks for watching. That was illustration. Greetings and credits to Dr.Dina, Ahmed, and lecture assistant Sinar. Thanks for watching. For more videos, ALMANSOUR-UNIVERSITY College, Medical Instrumental Engineer.